Hello everyone, and thanks for joining for today's video. I would love to request a subscription if you don't mind. So if you could subscribe to this channel, it would be most helpful. Lots of viewers are not subscribers, only about 10% are, so it would help a lot if you could, and like it if you do. Thanks. So today's topic is ingrown toenails because I try to do these videos for education and reassurance, and I try to base the topics off of commonly asked questions that I get. So we in the office see ingrown toenails very commonly, but I also just get a lot of people to text or Facebook message me to ask about them. One thing that's interesting is we will see funny shaped toenails in even a tiny newborn, but we don't really consider them ingrown because they generally don't get inflamed or have any infection or pus around the nail as a tiny baby. They may be a triangle shape like this, and you can just gently pull back or push back gently on that extra tissue that seems to be covering the toenail, and eventually it will look like a totally normal toenail as they get older. Now, after the baby's walking, it does become possible that it could be a genuinely ingrown toenail. So it's important to start at a young age, always clipping the toenails straight across and not deep on the edges. What an ingrown toenail is just where the edge has gotten torn or clipped too close, and then as it regrows, it accidentally grows into the actual flesh of the toe. And obviously when it breaks the skin, then that can become infected, red, tender, painful, swollen, and you can even see a little pocket of pus at that area. So if that happens, you can try to begin some at-home remedies. You can soak in warm water. That can be soapy water, that can be salt water, either one is fine. And then you want to gently push the tissue down, and if you can, lift up the edge of that nail bed that's trying to grow into the tissue, lift it up. And sometimes that can be tender, but if you can let that accumulated pus under there escape, then it'll feel a lot better. You can also apply antibiotic ointment on there. You also want the toes to not be restricted in a shoe with a tight toe box. You want a generous, roomy toe box. That's the area of the shoe where your toes live. It needs to be generous, or just let them, when you're at home, of course, just take your shoes off so they're not squishing your toes together, and that can cause ingrown toenails as well. So always clip them straight, don't clip them deep. Gently lift up, soak in warm water 2 to 3 times a day, and keep some antibiotic ointment on there. Now, what if you or your child develop these red streaks from the ingrown toenail, or the toe itself is entirely swollen, or there's redness extending down to the knuckle? That's a problem, and we should probably see you. And most of the time then we would start some antibiotics by mouth. Now, if this is a recurring problem, even in childhood, we will sometimes refer to podiatry or ortho, and mostly podiatry, and they can do a procedure in office usually, and it varies depending on which podiatrist you see and the size of the child and various things, but many times they can sort of surgically, with numbing, don't worry, remove a little strip of the nail on the edge, the one that's most often getting into trouble, and then they can cauterize or kill the little matrix, the base of the nail from where it grows, so that it won't reoccur. And then the toenail may look a little funny after that, a little skinnier because it's missing the side, but it can certainly help prevent future ingrown toenail episodes. So most of the time you can manage this at home, but always call your child's physician if you're seeing red streaks, increased pain, and don't do any sort of home surgery where you're digging deep into that the flesh of the toe, the side of the nail. You can certainly, we often will suggest using some dental floss to try to get under that nail and gently lift it up to let that pressure off from where it has been ingrown. So I hope this was helpful, because it is really a very frequent question that we get about ingrown toenails, and it can happen on any of the toenails, but obviously it's more common on the great or the big toe, on the outside or the inside side. Either way it can happen. Alrighty, thanks.